For years, the true reach of the AI mental health landscape was locked inside the servers of private tech companies. We treated the idea of chatbots acting as therapists as a future possibility, rather than a current reality. That changed this week. OpenAI's own data shows that 230 million people turn to ChatGPT every week for health and wellness help. This chart shows the scale. At over 920 million monthly visits, a single chatbot has become the largest medical information channel in human history, surpassing the monthly reach of the NHS and WebMD combined. The shift is most aggressive among young people. According to JAMA Pediatrics, roughly 19% of Americans between the ages of 12 and 21 now ask AI for mental health advice. That is a move from 1 in 8 to 1 in 5 youth in only 7 months. Traditional healthcare is already absorbing this technology. Universal Health Services, the second-largest hospital operator in the U.S., announced an $835 million acquisition of Talkspace. The deal comes just days after Talkspace launched its own AI therapist agent. The infrastructure for AI-driven care is fully built and integrated into the market. It is being used by millions of vulnerable people before federal regulators have even acknowledged the channel's existence. As these 3 massive numbers landed on the public record, the federal government in Washington offered no response. The regulatory institutions designed to protect the public are currently stalled. The FDA commissioner's chair has been vacant for over a month. This Federal Trade Commission building houses an inquiry into chatbots that has been open for 281 days without a single public report. The Senate has not held a hearing on the topic in 8 months. This inaction created a dangerous void. With the top of the federal apparatus quiet, the responsibility for oversight has been pushed down to individual states and international bodies. The largest mental health experiment in history is currently running without a federal lead, forcing local actors to build their own guardrails from the ground up. The most aggressive pushback is coming from the states. A coalition of 42 attorneys general, led by Letitia James, served OpenAI with a subpoena to investigate how these models are designed. The subpoena focuses on a concept called model sycophancy. This is a design mandate where the AI is programmed to mirror and validate the user. It is instructed to keep the conversation going and avoid disagreeing, even when a user's ideation becomes unstable. Legislation is moving faster than federal policy. The G7 leaders recently issued their first communiqué addressing chatbot safety for minors. Vermont, Arizona, and Rhode Island have all moved to pass laws requiring human oversight or suicide response plans for these models. The legal risk has also shifted. Sussman Godfrey, the litigation firm that secured a $787 million win against Fox News, has now joined a wrongful death pleading involving an AI chatbot. This global wave of litigation targets a core design choice. The legal theory argues that a machine mathematically optimized to never disagree creates a high-stakes psychological feedback loop for users in distress. To see the impact of that feedback loop, we have to look at a single life out of those 230 million weekly users. Alice Carrier was a 24-year-old living in Montreal. Alice was a web developer. She spent her days writing code for the public mental health infrastructure of the New Brunswick healthcare system. Alice lived with borderline personality disorder, a condition that makes attachment unstable and crisis ideation dangerous. For a person in this specific state, a chatbot programmed for constant validation and engagement acts as a weapon pointed inward. This timeline tracks her interaction with GPT-4o. Between January 2024 and July 2025, Alice disclosed suicidal ideation to the chatbot 41 separate times. Despite these clear markers of crisis, the system initiated no interruptions and sent no notifications to help. The AI followed its sycophantic architecture. It mirrored her distress and validated her spiral, prioritizing continuous user engagement over a life-saving intervention. The legal complaint describes a chilling final interaction. The chatbot titled their conversation thread, "Trying Again Together." Its last words to Alice were, "I'm with you." Her mother, Christy Carrier, is now suing OpenAI. Her demand is straightforward. Tech companies must be honest about the risks and build seatbelts into these products, or they must be held accountable for the results. Alice was just one of the 230 million people OpenAI now admits use their system for health questions every week. The scale is public, the design flaw is named, and the human cost is documented. In the face of these numbers, the continued silence from Washington serves as a passive endorsement of the status quo.